Dr. Yanta, and I'm an assistant professor of neurology here at Pitt Med. My colleagues and I would like to present the results of our study entitled Hybrid Lumbar Puncture Simulation as a Way to Teach EPAs 4, 11, and 12 during the medical student neurology clerkship. According to a 2016 survey, 57% of U.S. medical students do not perform a lumbar puncture, arguably the most crucial procedural skill in the field of neurology, prior to graduation. In 2014, the Association of American Medical Colleges identified procedural skill, along with obtaining informed consent for procedures and entering orders into the electronic medical record, as 3 of the 13 core and trustable professional activities that medical school graduates should be able to perform upon entry into residency. With this knowledge in mind, we developed a hybrid simulation experience designed to teach these EPAs centered around lumbar puncture. This simulation was incorporated into the neurology clerkship curriculum for 3rd and 4th year medical students in academic year 2019 to 2020. In the first part of the simulation, students were instructed to obtain informed consent on a standardized patient who presented with concern for optic neuritis. Following the informed consent portion, the students proceeded to a simulation lab where they were given instruction by neurology faculty or residents on how to perform lumbar puncture. They then practiced the procedure on specialized mannequins. The students were then asked to enter orders on the CSF into a simulated EMR. Real-time feedback was given with each component of the simulation. Students were asked to complete Likert-style surveys both before and following the simulation to assess their confidence and perceived skill with each element of the simulation. 84 students completed the pre-simulation survey, and 70 students completed the post-simulation survey. The percentage of students who increased their confidence with LP from minimal or less to average or more was 58.24%, 38.47%, and 26.38% for LP, informed consent, and order entry, respectively. Regarding perceived skill, the percentage of students who improved from not being able to perform or needing significant supervision to being able to perform with minimal supervision or independently was 25.27%, 47.25%, and 28.58% for LP, informed consent, and order entry, respectively. These differences were all statistically significant. When we analyzed this data by the time of academic year, we found no difference in improvement between students taking the clerkship earlier versus later regarding LP or informed consent. With order entry, a greater proportion of students increased their confidence and perceived skill earlier in the year as opposed to later. In conclusion, our study demonstrates that hybrid lumbar puncture simulation was effective at improving student confidence and perceived skill with 3 of the AAMC's core EPAs in which our clerkship was previously deficient: performing lumbar puncture, obtaining informed consent, and entering electronic orders. This effect persisted for LP and informed consent regardless of the clinical experience of the students. There was some attrition of effect with order entry, though there was still measurable improvement in this skill in later groups post-simulation. Thank you for your time and attention.